Hi. So you guys did a great job. I'm actually really interested in this topic. We kind of started learning about this in mental illness, and I also have watched a show about this on Hulu about a mother doing this to her daughter, which was actually took after a true story. So I just think it's really kind of fascinating. Um, this disorder is also called factitious disorder imposed on another, um, or you can call it MSP. This is obviously a mental illness, like you guys described, where a person's going to act as if if an individual, he or she that is caring for has a physical or mental illness when the person is really not sick at all. Um, so people that do this impose, they're going to be lying, obviously. They're always usually in the care of someone else, and the child's often if it's to do with children, the child's usually under the age of 6. Sometimes, though, it can be an adult. Usually, it's a disabled person or an elderly person, though, when this is happening to an adult. Um, so usually, this disorder is often seen in mothers. So although it can also be happen to be fathers too, but they usually intentionally are going to harm or describe non-existing symptoms in their children to get the attention given to the family of someone who is sick. When the person who has this mental illness uses the many hospitalizations as a way to earn like kind of praise for others for their devotion to the child's care, often using the sick child as a means for developing a relationship with the doctor or the healthcare provider. There's going to be certain kind of characteristics that are common in a person that has this disorder, usually being like they're usually a parent, usually a mother, like I said, but the person can also be an adult child of an elderly patient, spouse, or caretaker of a disabled adult. Sometimes being a healthcare professional or having medical knowledge is useful. Being very friendly and cooperative with the healthcare providers, appearing to be quite concerned. Some might seem overly concerned too about their child or the designated patient, and possibly also suffering from disorder can be also on their self. This is a related disorder in which the caregiver repeatedly acts as if he or she has physical or mental illnesses when he or she has caused the symptoms. Um, the reason we have to be looking out for this because obviously this is a form of child abuse. It is a form, obviously, it's done medically, but it is a form of physical abuse because you are, having this child do all these extra like medical tests or even possibly taking medications, which obviously could be harmful to somebody. Um, because why would you keep taking medicines and putting them in your body if you're not actually sick? So this is a real disorder. Obviously, like I said, there is a Hulu show that I watched that actually tells a true story of a woman doing this to her daughter for a very, very long time. So I do suggest everybody to kind of check it out, or at least maybe look up the story. It's very, very interesting, I believe. Um, it's just important to consider um, when these childs are victims of this is the child's condition consistent with the repeated history. It's also important to say, does the diagnostic evidence support the repeated history? Has anyone other than the caregiver witnessed the symptoms? And is the treatment being provided primarily because of the caregiver's demands? I don't have any questions for you guys right now, but I do think you guys did a great job. So keep up the good work this semester. Thank you.